First, check the arterial pH. Okay, if it is less than 7.35, that is acidemia. If it is more than that, that is alkalemia. Okay, and then, okay, so I am again writing that formula. Okay, bicarbonate and carbon dioxide. So here I'm going in this way. If pH is decreased, so guys, now I'm just covering the respiratory component. So just to be simplified, I'm removing the bicarbonate. I'm just having this pH is inverse with carbon dioxide. Okay, so first I will cover the acidosis, then I will cover the first I will cover the respiratory acidosis, then I will cover the respiratory acidosis. Then we'll move toward metabolic component. Just simplify the topic. Whenever I encounter a student or my colleague that is preparing for USMLE Step 1 or 2, I always convey to them, okay, just simplify the thing. Okay, most of the time when actually students come to that topic, they stop into compensation, okay, blah blah like that. Okay, just guys simplify the topic. First learn the simple basics, then move toward a complex thing like mixed disorder. Okay, mixed that type of disorder. First learn the simple thing, then move toward others. Okay, that is the way. Okay, most of the time when students come here, they just think that I should know about okay mixed type of disorder. I should know complex disorder. Okay, leave that. Just focus on the first learn simple, then move for the complex. So first of all, we just have the simple concept, then we move forward. Okay, so pH is here you can see pH is inverse with carbon dioxide level. So now I'm taking pH is less than 7.35. Okay, so I'm drawing this arrow downward. Okay, so I'm taking just respiratory component. Okay, how carbon dioxide can cause decreased pH? Okay, by increasing the level, by retention of the carbon dioxide, retention of carbon dioxide. Okay, just by retention. When the carbon dioxide level are retained in your body, you will have decrease the pH, and that is called respiratory acidosis. Okay, and now level will be more than 44 to 45. Okay, that will be your respiratory acidosis. In one word, you can say hypoventilation. How to cram these with mnemonic? Okay, I have made mnemonic in this way. Okay, in one word, I will say obstruction. At three level obstruction, from up to down. From CNS, I will say that is does mesonomer. I'm just using the mnemonic CNS obstruction. Then below is I will say neuromuscular obstruction, and then third is the I will say lung obstruction. So first is CNS obstruction. It is not CNS obstruction. Just there are some drugs like first drug, sedative, hypnotics, opioids, okay, barbiturates. These drugs actually block or you can say inhibit the medullary respiratory center, or there is severe you can say brain herniation, or there's severe brain damage that can cause hypoventilation. Okay, but in increase also increase intracranial pressure can cause hypoventilation. So brain is covered. Okay, opioid, sedative hypnotics, barbiturate, benzodiazepine. Okay, not so much, but barbiturate are lethal for that. Also, there are some okay trauma to brain can cause hypoventilation. One is covered. Then second is the neuromuscular obstruction. For neuromuscular obstruction, I will cover in this way: neurological causes and muscular causes. Okay, most of the example are not mentioned here. Okay, so remember neurological causes. So in one word, I will say neuromuscular obstruction. Okay, that is my second. First is my CNS. Let me write CNS. Second is neuromuscular obstruction. There are two causes. Neurological causes like polio, Guillain-Barré syndrome, myasthenia gravis, ALS. There are multiple neurological causes that can cause hypoventilation. Okay, so what is the cause of death in Guillain-Barré syndrome? It is the respiratory failure. What is the cause of death in myasthenia gravis? So that is the new respiratory failure. Okay, so you have to remember, okay, because there are multiple neurological disorders associated with respiratory failure. Okay, then next is the muscular causes like Duchenne muscular dystrophy, okay, myotonic dystrophy. There are multiple dystrophies that can cause hypoventilation. Okay, so that's all about. Third is the lung obstruction. It can be both acute lung obstruction, acute lung diseases, or it can be COPD, chronic obstructive lung disease. In those cases, you can have respiratory acidosis. So guys, remember three level obstruction: CNS, neuromuscular obstruction, and lung obstruction. That's all. We are done with respiratory acidosis.